little bit of housekeeping. Um, First thing to say is that live captions will be available throughout the webinar, should those be useful for you. But don't worry, because we'll also give you access to the slides, the recording, and indeed the transcript of the webinar after the session. So hopefully you won't miss anything there. We will use slides to guide our discussion and presentation, but we will also ensure that we read out everything that is on the slides. And as I say, you'll get access to the slides as well anyway. We really welcome questions today. So if you do have any sort of following the presentation and in the panel discussion, we ask that you use the Q&A function on Zoom today. We have disabled the chat just to make it a little less disruptive, and also because the Q&A function is a little easier to manage in this environment. And finally, just to say that the webinar will probably, when it actually ends, it will end quite abruptly, because that's just the nature of the platform. So we're not sort of slamming the door in your face or anything like that. This is just how the platform is. So just wanted to let you know about that. Okay, so what to expect from today's webinar? Well, firstly, I'll tell you a little bit, just very briefly, about our organisation, just to give you a bit of background and context. And then I'll be inviting Mark Upton from MyVision Oxfordshire to talk to us about the Green Walks programme that MyVision Oxfordshire are running. And then there'll be a panel discussion where I'll be welcoming Tanya Braun from Living Streets, and we'll hear more about Tanya and her organisation a little bit later on in the webinar. So just a little bit about me. There's a picture of me on the slide. I'm Kerry, I'm the webinar host today, but I'm also the programme manager here at Fight for Sight for Social Change. So what that means is I oversee our social change grants portfolio, and I look after our grantees right from the point of application through to the end of their project, and actually sometimes beyond that as well. So it's a very varied and exciting role. So a bit about Fight for Sight. Who are we? So we fund the brilliant minds and bright ideas of those who really want to put change on the map. So this is through both our scientific research funding and also through our social change funding. And the social change funding aspect and the social change area is what we're focusing on in today's webinar. And there's just a logo here of Fight for Sight as well on the slide. So as I said, we're going to be focusing today on the sort of social change element of things. And we very much are an evidence-based funder. So we want to make sure that, where we're giving our money, where we're putting our money, is where the need is most critical. And also we want our funding to be relevant to our sector and, of course, to the people that it's serving. So to do this, we talk with our grantees, we talk with key stakeholders in the sector, and we also commission research, as we have recently done with our Tackling Loneliness and Isolation area of focus. And this is actually the area of focus that is happening at the moment. And what we did was we commissioned Abertay University to do some research for us into blind and vision impaired people's experiences of loneliness and isolation. And from this research, we published our outside report, which again, you will get access to at the end of the webinar, and also it's on our website. And there were many things that came out of this report, many sort of sombering, quite sobering experiences of vision impaired people's experiences of loneliness and isolation. And what we found was that blind and vision impaired people are 3 more times likely to experience severe levels of loneliness and isolation than the general population. And as funders, we're always looking for ways that we can address some of these barriers that people are facing. We really want to take positive action on this. And as I said, to fund projects that put change on the map. And this is really what inspired our very recent funding rounds. So we started to fund a variety of projects. So we fund sort of sports projects to get people moving and sort of get them more physically healthy. We fund peer support networks and befriending groups. And we also fund projects that look for innovative ways to get people out and about, to get people moving, to get people in the fresh air. And that brings me really nicely onto the Green Walks programme. And I'm shortly going to invite Mark. But firstly, a little bit about Mark, just a little introduction. So, Mark has been CEO of MyVision Oxfordshire since 2021. He's also been visually impaired since birth. And as I'm sure you'll hear from when he's presenting, because he always does this, he's very passionate about inclusion and accessibility and about bringing lived experience to the sight loss sector. And indeed, he's chair of Visionary UK. So I think that's enough from me. And I would love to welcome Mark now to tell us a little bit more about green walks. Thanks, Mark.
Oh, thank you, Kerry. That's very kind. And yeah, thank you for inviting me. It's really special to be here. Really, really proud to be here, actually. And yeah, I just why I'm here is to kind of give a bit of background to the Green Walks project, what we do, why we're doing it, how it sort of came about, some of the research behind it. So hopefully I can give you a little bit of flavour to what we're up to and what happened. I'm going to start by saying actually I am really passionate about this, but I wasn't at first. And when we first were invited to take part in some research and research involved with green spaces, my kind of first thought was, isn't it obvious sort of the barriers for green spaces for visually impaired people? Like it's no, it's like a lot of the barriers that we face as blind and visually impaired people. But actually, as the research came out, there are quite a few things in there I had never even considered, angles and thoughts about, why blind and visually impaired people can't access green spaces. And actually, some of the solutions I was just so blown away, and now been blown away by the impact that I would call such a straightforward and basic thing to do, but the huge impact on people's lives is really, really incredible. So it started off by we were approached by Natural England and Oxfordshire County Council, which is our local authority here at MyVision Oxfordshire. So we cover the county of Oxfordshire and anybody with sight loss in that county. Now the county council came to us and said, look, we want to commission this research with Natural England and to look at the barriers that blind and visually impaired people face. So, along with other sight loss charities and the Research Institute of Disabled Consumers, they conducted the research which brought out some of the findings. Now, hopefully, we can share that somehow to you as a group, and actually it's on our website, and hopefully we can get that to you because it's a really interesting read. Some of the key findings and key barriers were really interesting. So if I just go through some of those, and some will be obvious and some won't. The first one being information about the green spaces. So where they are, things that are located in those green spaces. And actually, just to backtrack slightly in terms of what we're talking about with green spaces and green and blue spaces, we're talking about parks, recreation grounds, nature reserves, and then blue spaces, things like rivers, canals, lakes, reservoirs, that sort of thing. So, we all have them in our community. We all have sort of local parks nearby. So we're talking about access to some of these park spaces and green spaces within our community. So information about where those places are. And do you know what? It's funny we said that because where I work here in Oxford, I've worked here now for just over 10 years, and it wasn't until maybe 2 or 3 years ago I realized tucked behind some of the houses was a playground and a park and some benches. I had no idea it was there, and there was a signpost apparently to it, and I had not known. So actually, I am a culprit of not knowing where some of these green spaces are. And it is so true for blind and visually impaired people. So often we focus on routes, A to B, getting to the bus stop, getting to your workplace, getting to the shops. But we don't focus on actually how do we get to the park? Where's the park? How do we get to the nearest green space or the blue space? Or how do we just go for a walk? We're so focused on doing the journey that we don't think about actually just going for a walk. And actually the information about that is a key barrier and a key problem for people. Um, Another one, which was so clear and so obvious now, is about transportation and transportation links. We've got a fantastic reservoir here in Oxfordshire, just outside Oxford. Brilliant place to go for a walk. Really beautiful, really nice surroundings. but the bus stop is about a 15-minute walk away and there's no footpath. So if you're visually impaired, you're very unlikely just to hop on the bus and go there because actually you've got to walk down the middle of a very busy road. So that, that's a kind of example of an inaccessible space to go for a walk. And there's lots of these examples, particularly when we talk about nature reserves and other places like that just aren't accessible. Um, then there was points about safety concerns, and this is one I hadn't really considered personally myself, but actually, feeling of safety and being vulnerable in an open, wide space, people were really commenting on this and really highlighting this in the report that actually there is a lot of safety concerns, particularly if you're on your own, you're in a wide open space, and actually your bearings and understanding your surroundings and where you are can be very, very kind of off-putting for people. So actually, just to go out for a walk and a stroll, on your own, the safety concern is definitely there. And then there's just again lack of opportunities for people to get into these green spaces is another area of concern. Within the report, they highlighted some of the key kind of recommendations, and yeah, there were lots of things. Obviously around accessible information, technology, making sure the things are accessible, maps and getting the right accessible information, transportation links, making sure transportation is linked to green spaces, and then things like actually, issues you might find within the green spaces themselves. So curbs, pathways which are level, things like gates which might not be accessible, and facilities within those green spaces. Where are the toilets? Are there any? Where are the benches? Are there picnic areas? How do I actually get out of the green space? I mean, that's such a bizarre thing to think of, but once you've got in somewhere, there's a big park not that far from us here in Oxfordshire, and it's really big, and you can easily get lost. And if you can't read the signs, how do you get out? And it can be quite concerning. Um, so things like that, improving those things are really important. And the last recommendation was a really interesting one. It's actually about planned activities and planned tours and walks of local green and blue spaces for visually impaired people. So when we met with Natural England afterwards, the report was done and they came to us and said, okay, what can we do that's actionable? We want to pilot something. We want to pilot, something out of this. So they came to us and we were like, well, we could spend ages campaigning with a local authority to improve some of these things, but actually, is that going to be worth the time, the hassle for us as a small organization? We might see some small improvements, but actually that's not the area of our expertise as an organization. And it's something, to be honest, can be a bit of an uphill battle. But the last recommendation really interested us in terms of those planned activities. And our feeling was, oh, well, we can get, we have social groups, we have people, we can get people together, we can probably gather people. And actually, so from the back of this report, a research and report, we formed a pilot walking group. And we did that with a focus. So we, excuse me, we launched that in Didcot in South Oxfordshire, so a local town within the county. We had a social group, and we thought, let's start that off the back of the social group. Okay, who wants to come on a walk with us? And we did that. We said, okay, we're going to do it every 2 weeks. And within that 3 month period, we're going to do a report. We're going to look at and measure some of the impact. We're going to measure what we've been doing. And we're going to have a focus group on the back of it to see differences making in people's lives and also to feed into the wider project and how we should grow it, what we need to be thinking about to improve these walks and actually to ensure that it is driven by blind and visually impaired people, that we're not as an organization just going, right, here's what you're getting, this is your walk, this is how we're going to run it. Actually, it was driven by the people within the group, and we'll talk about some of those findings in a minute and how it has shaped and changed our thinking over that time. So we started in January, which, if you can imagine, is probably the worst time to start a walking group. But actually, for us, it was really interesting to see how that developed over time. And we started walks with a very small group with about 4 or 5 people, and that grew over that 3 month period. And so, in terms of practicalities, what we've done since then. So we launched a pilot in January, and from that point, we've now extended walking groups across the county. So we had our first group in Didcot, and we then extended to another town nearby called Abingdon. We then we're in another area, East Oxford, so just part of Oxford. We've now got a group in Witney, in the west of Oxfordshire, and Banbury in the north of Oxfordshire. So we have those groups across the county, and they all meet bi-weekly. So they meet every other week, and we're gathering around 5 to 10 people per group. So each group has about 5 to 10 people, and it's very much peer support. So it's very much about gathering together people. Each group has a WhatsApp group, so they can gather, they meet together, they arrange where they want to go beforehand and how they want to run the group. And they meet in all weathers. They meet in obviously in different locations. The other thing that really focused around is there's always a point for coffee. So in fact, our comms officer got a little bit annoyed because one of our workers was always taking photos after the walk when they were sitting down and having coffee. It's like, does anybody actually do any walking at these walking groups? But obviously, when they're walking, it's not their focus to take a photo. So there's a lot of sitting around at the end of the group to have a coffee, and that kind of often gives people that kind of that drive to go and get a coffee and have that social element at the end. Um, so that's kind of the structure of the group. Those are supported by our community engagement workers. So that's a member of the MyVision staff who will support those groups. Generally go to each one, but what we're aiming is to start to ease that support off where it becomes a self-sustaining group supporting each other. Like I said, it's very much peer-led, very much driven by what they want to do and how they want to do it. And that's how we started. Now in terms of the future, we want to grow that. There's more areas in Oxfordshire to do that. We're also planning on a bit of a framework on how to set these groups up and how to support people to run their own groups across the country, so we can have a bit of a framework and a model that others can follow. Um, and utilize that. Within all of this, it's all about collecting data and collecting information and gathering that information to help shape the service and help shape our understanding of the impact of the project and how it is supporting blind and visually impaired people. So if I go now just to talk a little bit about the impact, and sorry, I will just continue talking until I drop. So, Kerry, do just shout when I have to stop, because this will probably just go on. It is fascinating, kind of understanding about how this is happened. So, on our website, we have just published the report for the pilot group. So this is the first 3 months, and we've had a focus group on that. Some of the big outcomes have been obvious, but some not, maybe not so obvious. What we were looking at is obviously several key areas of outcome. The first one is combating loneliness, so getting people who are potentially isolated in their, not getting out into their community, stuck at home, really feeling they couldn't get out on their own. So it's ensuring that we have people connected with their community, and we believe that actually getting people into their local green space opened up their own communities to them and areas where they may not have gone before, which is really, really a powerful thing for somebody. Again, we so often focus on sort of rehabilitations, getting people from A to B, where you need to go to the shop, you need to get to the doctors, but actually we need to get into green spaces as well. We need to get outside, we need to get into nature, and we need to get that community support, which, as we know, as evidence shows, has a huge amount of positive impact on our mental well-being and physical well-being, which is the next area, which is physical and mental well-being, has really grown for people. So actually just going for short walks. We're not talking about hiking. We're not talking about going for a 20-mile ramble over the local hills. We are talking about doing a 1 to 2 mile stroll around the park, maybe a bit further. And what we noticed is actually for the first few walks, it was quite short walks, and those have grown and grown and grown. And we've been able to measure that actually physical fitness, people are feeling more physically fit because of this. Um, the other thing is independence and confidence. So actually, the individual's confidence is really growing, both confidence in engaging with other people, but also engaging with their local green spaces and getting connected to nature, getting more confident in their own abilities and their own sort of mapping, I suppose, of the local green space. And this has been evidenced also by the fact that they've been coming to green walks, but they've also been able to organise their own um, walks, on their own and with others within the group, and then with family and friends outside of these groups. Because the end goal isn't that they just come to our green walk sessions. The end goal is that they can get out into nature on a regular basis and that they feel more confident to do that. And actually going into their local green spaces with a group has enabled them to understand that area, to build confidence and knowledge of that local area, to feel they can go back again. And I'm sure a lot of blind and vision impaired people like myself will be able to say, actually, do you know what? When you've gone to somewhere once, twice, maybe three times as a group, you feel so much more confident going there on your own or with one other person because you've kind of mapped it out. You know where you're going, you know what the routes are, and you know what the location is like. So that's been a real game changer for us, and just been able to see that confidence grow in people. Um, and so those have kind of been the main kind of impacts for people's lives. We've also seen a lot of people grow confidence using public transport. So within the pilot group, they didn't just want to do one area, they started to grow in confidence as a group and wanted to go further afield. So they actually took the bus together, and they took the bus to a another green space in a different area where they'd never gone to before. And that was driven by one of the members who actually tried to go on a visit somewhere but couldn't get there on her own. And they went as a group. And amazingly, we had one person within the group who had not been on a bus for 15 years or so because of losing her sight and just lost that confidence. But within the group, she went on the bus with them, learnt from others and understood from others, how they do it, how they flag the bus down, how they manage getting on the bus, and is now doing that on her own and now able to get on the bus on her own, which is a huge, again, that building confidence. We've also found that actually doing things as a group, peer support, being able to support each other. So actually having that reliance on each other has been really valuable for people. And actually, one of the findings is that even if the weather's bad, they know that if they're going as a group, they feel like they rely on each other, and there's that need to actually go, rather than going, do you know what, I could miss it, I don't need to go. Actually, if you feel you need to be there to support others, and if you feel you need each other on this walk. It's actually driven people to go out even when it's been raining or absolutely freezing. So that's been really inspirational to see those groups kind of come together and support each other. Um, so that sort of wraps it up. We've been really excited to see how people have grown, both individually, the groups have grown. We've been focusing on sort of, like I said, about 5 to 10 people within each group, and that's been excellent, and that's been really game changing for those people. We want to see more of these. The end goal isn't just to have lots of walking groups. The end goal is to really see people out and about, on their own or in their own settings, engaging with nature, engaging with their community through these green walks. So it's very exciting to see how that's developing, and I think we're going to talk a little bit more about other bits in a minute, but that's that in a nutshell. Hopefully that gives you a bit of a flavor. And what I would say, I really recommend reading the report, because there's lots of quotes on there about how this has impacted people. So it's on our website, and hopefully we can link to that in the end email or the follow-up email. So back to you, Kerry. Thank you.
Oh, brilliant. Thanks so much, Mark, and thank you for sharing that presentation with us. I really think that is just a shining example of how change is being stimulated through kind of practical and hands-on action-based work, just going out there, doing it and having a go. And that is just brilliant. Thank you so much. Um, so before we launch into a bit of a panel discussion, I'd really like to introduce Tanya Braun from Living Streets. Tanya, it'd be great just to hear a little bit about your organisation.
Thanks so much, Kerry, and really good to hear about all the amazing work you've been doing, Mark. So thank you for your presentation. So I'm from Living Streets. We are the charity for everyday walking. Born from the Pedestrians Association, we'll be celebrating our centenary in 5 years' time, which is really exciting. So we're very focused on improving streets for walking, improving the walking environment, and that's really where we started as the Pedestrians Association. But we're also today focused on inspiring people to walk more, and we run projects up and down England, Scotland, and Wales to support people really to do more walking in their daily lives, whether that's walking to school, walking to work. We do sort of community focused projects where we take maybe older people out for walks, a bit like what Mark was talking about, sort of walking groups. And we do a lot of work on in it recommending changes to the streetscape to local authorities.
Brilliant. Thanks, Tanya. That's a great introduction. So now we're just going to have a bit of a discussion panel. I had a couple of questions that I wanted to ask, if that's all right. Firstly, to you, Tanya. So we've heard from Mark about obviously the benefits of walking in rural spaces and green areas, and kind of why it's important to really protect that. Wonder if I could just ask you about what would you say are the sort of key benefits to walking in the city, and why is it so important as well to protect those kind of city walking experiences?
Sure. So we heard a bit from Mark about the benefit of walking for our health. So walking it's free generally, it's accessible, it's an activity that we can all generally take part in, and it is great for our health. Chris Whitty, the Chief Medical Officer, talked about sort of walking as a miracle cure because, in moving our muscles, we can create new brain cells. Physical activity has been shown to reduce the risk of things like depression by about 30%, heart disease by up to 35%, and type 2 diabetes by up to 40%. So it's amazing for our health to get out walking, both for our physical and mental health. But there are other benefits too. So Living Streets, we've just launched a new report ourselves, which is a third edition of our Pedestrian Pound report. And this report shows that walkable realm is really good for boosting business. So where local authorities have maybe pedestrianised certain areas, for example, in Shrewsbury, they've been trialling some weekend pedestrianisation, which has boosted sales in those areas by 25%, which is really amazing. But our new edition of the Pedestrian Pound shows that walkable realm doesn't only boost business, but can also bring lots of value to communities, but also to public health savings and environmental savings. So, for example, the number of deaths averted by walking to work was over £600 million a year in Scotland. And we've seen through one of our projects, which is called Walk to School Outreach, which focuses on encouraging primary school pupils to walk to school, that we can take a lot of cars off the road by encouraging walking, and that this can then therefore have a benefit to sort of the carbon emissions that our transport sector is sending out. So there are multiple benefits, and I would say that in terms of in cities particularly, it's really important that people are able to walk to their shops, to public transport links, so that we can take cars off the road, and we can lead less perhaps sedentary lifestyles, and that we can reduce the kind of road danger elements that motor vehicles have for us as a society, but also improve our air quality.
Brilliant, thank you. And another question for you, Tanya, if I may. This project was born out of the Natural England report, which focused on the value of being able to access green and blue spaces, but it also talks about many of the barriers to access that people might face when accessing green and blue spaces. I just wondered for you, kind of what would you say are the main barriers to access that people face when they are wanting to do these city walks?
Yeah, thanks for that question. We have done a lot of asking of members of the public as to what the barriers are. So, for example, pavements. Mark mentioned a lack of pavements. That would obviously be a major barrier, but also the state of our pavements. So, are they smooth and flat? Are they wide enough for wheelchairs or buggies? I have twins. I have a double buggy. I need the pavement to be really wide. So having really good accessible pavements is a really key thing for encouraging walking in cities and other places, towns, wherever. But certainly a barrier is bad or broken pavements. Alongside that, pavement parking we hear is a major barrier, and we have members and supporters of the charity to whom I would say pavement parking is definitely the number one gripe and the number one barrier to them being able to enjoy more walking in their local areas. It is banned in London, and Scotland have begun to ban it nationwide, but we've been campaigning for decades to have pavement parking banned in England and indeed in Wales. And we would really like to hear more from national government on that. Other barriers are sort of perceptions of safety, and that can encompass lots of things. So, for example, being able to cross roads safely. So lots of crossing points, adequate crossings, crossings in the right places. If you need to cross from a residential home to the doctor's surgery, you don't want to have to walk half an hour down the road to be able to cross. I mean, I'm exaggerating a little bit there, but you don't want to have to go miles out of your way to be able to get across the road. We believe, we've seen that slower speed limits are really key. So it's much safer for people to be walking around, crossing roads when speeds are lower, so 20 mile per hour rather than 30 mile per hour or higher. Also things like street lighting, street furniture, having those available so that people feel that they can be comfortable and safe out, whatever the sort of weather, whatever the season. And yeah, I mean, sometimes we hear the weather is a barrier, which is maybe fair, but we would hope that generally we can be prepared for the weather rather than sort of having it put us off, because there's not much we can do about that.
Brilliant, thank you. I think that's really interesting, and also, like, even though obviously you're more focused on the city walks and Mark's more focused on the green spaces, like that's quite similar in a way, sort of intersecting barriers in a way as well.
Yeah, definitely.
Yeah, I think so, definitely too. A question,
Kerry, sorry to interrupt.
Oh,
I've got sorry to interrupt. The reason I wanted to is because I've got a question from the audience, which is a bit of a follow-on from Tanya.
Perfect.
It's from Claire. We are struggling in Surrey with an increase in hard surfaces, which is having an impact on the confidence of blind and vision impaired people in using pavements. Are Living Streets working on this nationally? These schemes seem to be being endorsed by Active Travel England, and I wonder if you are working with them.
On hard surfaces.
Sorry.
Oh, sorry.
Shared surfaces, which is having
shared surfaces.
I couldn't work. Sorry, Claire. Thank you for clarifying.
Yes, we appreciate that shared services pose problems, are problematic, and generally we like to see very clear, kind of segregated paths for different users. We do really support all active travel, so cycling, walking, wheeling, everything, but we do have members who can feel fear when they encounter cycling in the areas where they're walking. So it's very much a live issue for us, one that we are working on and considering, because things are changing quite frequently in terms of what our sort of walkable realm looks like. But generally, we do believe that we're very supportive of kind of cycle lanes, where we would like to kind of see the e-bikes, e-scooters. We would like legislation to sort of be clear that e-scooters cannot be used on pavements. So hopefully that answers your question.
Amazing. Kim, do we have any other questions actually at this point from the audience?
We do. So again, from Claire, what a brilliant, to Mark, what a brilliant project. We would like to do something similar and learn from you. A key question for us is around sighted guide support and how that worked. And Maureen from another organisation also asked a similar question about, hi Mark, you didn't mention sighted guides. Do you not have guides within the groups?
Oh, sorry, I'm muted there. Yeah, that really interesting. So this is goes to I know sort of what Kerry's going to ask me about what surprised us. So as we were developing the project, we developed within that project, obviously trying to ensure we have volunteer sighted guides, and to be a part of this, to make sure we got people with the right guidance support. And what really surprised us is actually the lack of need for sighted guides. Now, each group does have sort of one or two people with sort of sighted support, but actually we found that what was actually more empowering for the group is what we've kind of coined a collective vision or a collective ability, I suppose. So we all know that blind and visually impaired people have a mixture of their sight levels. We also know they have a mixture of confidence and ability, and a mixture of length in times of being vision impaired. So with somebody who's been born with a vision impairment, may have different take on it. Somebody who's only just been diagnosed and just experienced sight loss. So what's been really interesting is actually how they've taken that as a collective. So the group are actually supporting each other within that space. So somebody who maybe have a bit more confidence or a bit more vision, doesn't necessarily mean it is that way, but somebody who's a bit more usable vision is actually supporting other members of the group. Which some people will absolutely bulk at, and I understand, because we are a very health and safety conscious society, and what we tend to get told by what I tend to find sighted individuals is we must have sighted guides. You have to have sighted guides for everybody. Everyone's got to have a sighted guide because our insurance won't let us, blah, 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 blah. Okay, but let's see what the group want to do. So actually what the group ended up wanting to do is felt actually they didn't want sighted guides, and the groups often didn't want other people to guide them because actually they found they can guide each other and they were more confident. Now that will not always be the case. So you may find you get a group together and actually you find that people, you've got a group of people who are less confident and don't feel they can do that. Interestingly, all our community engagement workers are all visually impaired. We're a very strong advocate as an organisation of lived experience. So a lot of our staff have sight loss themselves. So the ones actually leading the groups are often visually impaired as well. And this is really interesting because actually sometimes they're working it out together and they're working out these routes together. The other thing which is really empowering is that, like I said, when the groups need each other, they are more inspired to go on the walk and to go and support their peers. So if, let's just say, you are visually impaired, but you're also supporting guiding somebody else within the group, because visually impaired people can still guide. I'm just going to put that out there. You're actually more empowered to go on that walk and more feeling like, oh, the weather's rubbish, but I know that my friend actually needs me this week and needs me to be there to support them. And that actually goes to, if we talk about the 5 ways of well-being, about giving back and about feeling useful. I know that some of the people that go to the group actually feel useful and needed, which goes a huge way to their own confidence building. So it's interesting that this has been really surprising for us. We did plan to have, and recruit volunteers and sighted guides but actually it turned out to be more of a peer-led group, a peer-led support group, and we've kind of replicated that across the county. Now it does vary from group to group. It will depend. So some people, we do have other people that do feel they need a guide more, and we partner those up with volunteers. So it's not a completely set in stone way, but I think we were really surprised, and I think it's been a real bonus of the group to see that peer driven method. It's also been quite releasing because also we know how difficult it is to get volunteers who we can rely on a weekly, bi-weekly basis. So it's helped us in that sense where we've not felt, well, we can't run it because we haven't got 5 guides. Actually, we can run it because they're going to support each other. So it's been really interesting on that sense, but maybe not the answer you were hoping for. But what I would say is far more releasing and inspiring for the group.
Brilliant. Thanks, Mark. I think that is a really inspiring approach, actually. Before I ask another couple of sneaky questions, does anyone else have any other questions that they'd like to ask? No? Okay, well, if they come in, then that's fine. They can trickle in.
I'll let you know. Yeah, nothing for now,
brilliant. Thank you. Mark, I'm gonna put you on the spot again. I think I might ask you. You did sort of touch on this, but what surprised you most about the green walks, and also what's been your favourite learning from the program? Would you say?
Yeah, so definitely the peer-led element has been the biggest surprise, I think, for us, and the thing which has really kind of taken off, I suppose, and helped support and develop the group in that way. I suppose also the simplicity of it has been really surprising. It's not, actually because it is very much peer-led, and we can support that within the environment. It is really kind of quite simple to run. It's quite simple to get it off the ground. And actually just to get people out and about. In terms of learnings, I think actually, like I'm going to just be personal about it as well. I kind of didn't really realize the huge impact on just going for a daily walk on your life that can be. So as part of the research in this, obviously, and part of what we've developed, I've learned quite a bit about just getting out about in green, just getting out into nature. And just there's so much about nature, there's so much about walking which can impact, not just your physical health. That was obviously an obvious one. The more I go for a walk, the fitter I feel. But actually, and I feel like my colleagues think I'm just a bit weird, but every day I will go out for a walk. If I'm in the office or I'm working from home, I will just go out for a walk, regardless if I've got anywhere to go. I would just go for a walk, turn around, and come back, and because it is actually really, and again, I knew like getting away from your work is really useful, but actually, just the more you read about, the impact of walking on your brain health, on your mood, like is a really just a needed thing for us to do. And I'm just so pleased that we can facilitate that in a small way for some of the people we work with. Some of the people who we know are isolated, are lonely, do find it really hard to access physical activities generally, do find it hard to access their communities generally, actually just to boost their mood and to boost everyone's mood just by getting out and about and in touch with nature, so to speak, is really just quite empowering and quite just it again seems so simple. It doesn't feel like we've done anything huge in that sense, but actually the impact, for what I would say is small investment in these people, it has huge returns on their life. So I think that has been really surprising and a huge learning thing for me. And in fact, we've even, just as a team, as a staff team, we've kind of developed a bit more of a culture of just actually just having, more meetings outside. Actually, just if when you've got your one-to-one meetings, can you do that as a walk? Some of our team days, we've just done a walk. Let's just go for a walk, go and grab coffee, go and have lunch somewhere. But we'll add a walk element into it. Because it just adds so much to people, particularly those who aren't moving that much, just as a huge amount to their life. So, and as a personal level, it's really impacted me and our team here in terms of developing kind of a bit of a walking culture, so to speak.
Definitely. Thank you, Mark. Um, I'm just going to finish off with a bit of a spontaneous question for both. I guess this could be for both of you. Mark, I'll start with you. Like in a dream world, where you've got unlimited kind of resources and funding and anything that you need, how would you like to see kind of your project, your program really expand? Like what would be the kind of dream scenario?
That sounds like an amazing world, Kerry. Like unlimited funding. I mean, you're talking my language.
No
Um,
food guarantees, Mark.
yeah, yeah. Yeah, that does sound definitely like a dream. But in terms of how we want to see this grow and develop, obviously we started with a pilot, we've rolled it out across Oxfordshire. We want to expand it across Oxfordshire. But interesting what Claire's saying, we want to support other organisations. So we want to build a bit of a framework. And again, it's not going to be overly complicated, but we want to build a little bit of a framework on how to get this off the ground. And within all this project, within even this year, what we're doing, and hopefully in the future, we're just gathering more and more data in terms of the evidence of what the impact of just getting out and walking can do, and particularly in terms of prevention. For and actually you could go as far as a prevention of obviously other illnesses, and the amount I think we would actually save the economy and NHS and things in terms of doing this is huge. So we want to build a bigger evidence base, both locally and nationally to prove that actually doing this is saving X, Y, Z, and hopefully influence a bit more policy in terms of supporting more and more green walks. And I think there's a lot more going on. We also and I just add this in, we recognise that doing visually impaired walks just for visually impaired people isn't for everybody. We also want to make sure that we can integrate people into other walking groups and ensure that those are accessible. And with people that want to go on longer walks, on bigger hikes, or join in another walking group, these walk and talk groups that you can go on, actually making sure we can integrate people into society, because it's not just about doing things just for visually impaired people in their own bubble. Eventually, and what we've found is that as people's confidence is growing, they've got more confidence to just go and join another group. So that's kind of my dream world, really, is that people just gain that confidence to be out there in society. They're seen, people understand visual impairment more because of it. And it's kind of has that knock-on effect that we're all kind of engaging with real world, other groups and other sort of social activities.
Brilliant. And Tanya, how about you? Like, what would you like to see in terms of access and things if you just had unlimited resources?
I mean, I'd have to agree that Mark's World sounds fabulous and concur with that. But I suppose perhaps just to say something else and maybe just come at it from a slightly different angle, it would be, that the barriers that do exist for many people to kind of walk out of their front door and feel comfortable to walk to their local shops or to their school or to work or wherever they want to go. It could even be, to join others on a green walk, are reduced or completely taken away. And for it to be understood what those barriers are, and yeah, for local authorities, I suppose, in the main, to go about breaking those down. So improving pavements, lowering speed limits, introducing crossings, and all of the other things that I kind of mentioned before, so that when and if people do appreciate how amazing walking can be, even if it's for 10 minutes, that they can do that in their local communities.
Okay, well, hopefully we'll get to that point at some stage. That would be absolutely wonderful. But honestly, thank you both for taking the time.
I've got a couple of questions that have come in. if we can steal your time for 5 more minutes or 9 more minutes, it's 10 to 2. I hope we can keep it a bit longer. But I've got a question from Charlie. We are working on the same issues in Bristol and Bath, and I'd love to know if there's anyone else listening who might be up for partnering. Is there a way to connect people on the call who in the area are working in the same area? Oh, sorry. basically connect people on the call. I might answer that right off the bat if that's okay. Charlie, I think what's best on that one is if you email comms@Fight for Sight with that, and then yeah, we can take that offline. Or if anyone has an answer for Charlie, email comms@Fight for Sight, and then Charlie, I can let you know. And Mark, there's a question from James. Is there a need among the groups to constantly find new routes, or are they happy to cycle through a few favourites?
Yeah, it's totally mixed. So each group is different, and that's something I'm not sure I kind of spelled out. But every group is totally different in terms of what they want to do. But yeah, some want to do new routes. Some, we thought we were going to be doing the same routes over and over, or the same parks over and over, and different routes in it, and just having a coffee at that local coffee shop. Actually, because they got more confident, they got more ambitious. So, they got on the bus, they went further down, they went to some of the green spaces which they never would have gone to before. Not the one which is just down the road, but the one which is a 20-minute bus ride away. So, that's the thing, and it's just developing as their confidence has developed. They've gone further afield, and it's as we come through to winter, I'm sure the routes will be a little bit shorter, a little bit closer to the coffee shop and the warm space. But yeah, it's so varied. It again driven by what the group want to do. That's the kind of the beauty of it, we feel.
Great.
That's brilliant. I've got a few more if we've got a little bit more time. So there's quite a few people who are very interested in connecting with other organisations on this group or with you, Mark. Would it be all right if I say just email comms@Fight for Sight and I can make the connection?
Perfect. Yeah.
Lovely. Thank
Yeah,
you.
and also Kim, if I can just come in on that.
Course.
We're really keen here, particularly within our kind of social change funding, about people coming together and collaborating and being in partnership and sort of sharing learning, because what we want is a coherent sector where everyone, like the service provision is available for everyone. So these kind of collaborations really are what we're really encouraging. We'd really like to hear more about. So yeah, please keep them coming. That's great. Sorry, Kim.
It's totally fine. Yes, Katie, I will pop my email address into the chat for everyone if you need to communicate. I think that's all we have time for today. I think I'll end here if that's all right.
Okay, yeah, perfect. So just before everyone pops off, we've got just a bit more information about like green walks and living streets and our funding and our report. But again, you'll have access to all of that after the session. And just to say that this webinar is a part of a series of webinars actually that we're hosting. So always keep your eye out for details on those. And indeed, our next one is going to be focused on our sort of more scientific research side of things, and it's going to be by Dr. Lola Salevo, who's going to talk about her research into prevention and diagnosis of sight loss for children. So if you'd like to attend that, you would be most welcome. But I think all that remains to say is thank you so much to both Mark and Tanya for your time. Really, really fantastic stuff. And thanks everyone else for coming and for your time as well. So thank you so much, everyone. Enjoy the rest of your day.
Thanks
Thank
all.
you.
Thank you.
Bye.